Hi, my name's Allison Lloyd, and my movement analysis video is on walking. When walking, we cycle through 5 separate phases. I will be referring to these phases to explain the muscles being utilized during each. The first phase is called heel strike. It begins when the heel touches the ground and lasts until the whole foot is on the ground. The second phase is early flat foot, which begins the moment the whole foot is on the ground. The end of early flat foot is when the body's center of gravity passes over the top of the foot. The third phase is late flat foot. Once the body's center of gravity has passed in front of the neutral position, a person is said to be in late flat foot. The fourth phase is heel rise, which begins when the heel begins to leave the ground and ends before the toes leave the ground. Lastly, the fifth phase is toe off. The toe off phase begins when the toes leave the ground until a heel strike occurs in the next cycle. The joints used while walking include joints of the hip, knee, and the ankle. The hip joint is located where the head of the femur meets with the pelvis at the acetabulum. This forms a ball and socket type joint. The movements that occur at the hip joint when walking are flexion and extension. The hip is flexed during the latter half of the toe-off phase, heel strike, and early flat foot. When the hip is flexed, the muscles contracting include the tensor fasciae latae, the pectineus, iliopsoas, rectus femoris, and sartorius. The hip is extended during late flat foot, heel rise, and the beginning half of toe-off. When the hip is in extension, the gluteus maximus is contracting with help from the hamstrings, which include the biceps femoris, semimembranosus, and semitendinosus. The knee joint is an articulation between the condyles of the femur and the tibial plateau. The patella also articulates with the femoral notch. The joint type is a hinge joint. The movements that occur in the knee while walking include flexion and extension. When the knee is flexed, the muscles being utilized include the hamstrings, sartorius, and gracilis. When the knee is extended, the muscles being utilized include the muscles of the quadriceps. This means the rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius are all contracting. The talocrural joint is where the talus meets the tibia and the fibula. It is a hinge joint and allows for dorsiflexion and plantar flexion. The ankle is in dorsiflexion from the latter half of toe-off until early flat foot. When the ankle is dorsiflexed, the muscles contracting are the tibialis anterior, peroneus tertius, extensor digitorum longus, and extensor hallucis longus. The ankle is in plantar flexion from heel rise through the first half of toe-off. When the ankle is plantar flexed, the muscles contracting include the gastrocnemius, soleus, tibialis posterior, peroneus brevis, peroneus longus, flexor digitorum longus, and flexor hallucis longus. There is only one plane in which walking occurs: sagittal. When the hip is flexed, the knee is in extension and the ankle is in dorsiflexion. The agonist muscles at each joint at this point are all anterior muscles in the leg. The antagonist muscles in this process are also agonist muscles when the hip is extended, the knee is in flexion, and the ankle is in plantar flexion. At this point, the agonist muscles are all the posterior muscles in the leg. It is important that while the agonist muscles contract, that the antagonist muscles relax. The cycle involved in walking includes a series of isotonic contractions alternating the anterior and posterior muscles of the leg. Injuries that could occur from walking would most likely be due to overuse and abnormalities in the ankle joint. For example, someone who has pes planus or has fallen arches would possibly suffer an injury if they are an avid walker. Their injuries would most likely be medial in the knee because weight would be distributed to the medial aspect. Conversely, someone who is pes cavus or has extremely high arches would experience lateral knee injuries due to weight distribution. Someone with high arches would also be more likely to suffer bony injuries because the bones are stacked on one another and bear the entire weight on the ball of the foot as well as the heel. Alright, I'm going to demonstrate a lateral ankle sprain. So if you're walking on an uneven surface and you miss your step and you invert your foot, that would result in a, oops, you can't see it, a lateral ankle sprain, and your whole weight of your body would be on your foot. Sprains can occur from inversion of the ankle, resulting in a lateral ligament sprain, or from eversion, resulting in a medial ligament sprain. Injuries to the knee may occur when one has a wider pelvis, which is measured by a Q angle. This is the angle at which the femur meets the tibia. It is measured by creating two intersecting lines, one from the center of the patella to the anterior superior iliac spine of the pelvis, the other from the patella to the tibial tuberosity. On average, this angle is degrees greater in women than in men. The increased angle places more stress on the knee joint. Patellofemoral pain syndrome is due to a high Q angle, which causes the quadriceps to pull on the patella and leads to poor patellar tracking. Over time, this may cause knee pain and muscle imbalance. Also, a high Q angle can cause chondromalacia of the knee. This wearing down of cartilage on the underside of the patella leads to degeneration of the articular surfaces of the knee. In preventing injuries that are due to structural abnormalities, an orthotic is a common treatment option. Orthotics provide structure to one's knees by disallowing pronation due to low arches or supination due to high arches. They also put less stress on the knee by improving one's Q angle. Also, as an injury prevention method, stretching exercises should be implemented to stabilize one's joints. Common muscles to stretch include quadriceps, hamstrings, the IT band, and gastrocnemius. In addition to lengthening these muscles, strengthening them is also essential to preventing injuries. For example, the quadriceps can be strengthened by doing leg extension, the hamstrings by doing curls, the IT band by abduction, and the gastrocnemius by doing calf raises.